Welcome to ZMS online and offline platform. Today I'm going to discuss about cardiac anatomy. First of all, we should know about chambers of the heart. We know very well from the basic science. There are four chambers of the human heart. One is right atrium. Second is right ventricle. Third one is left atrium, and fourth one is left ventricle. Right atrium receive blood from the superior vena cava from the above and below from the inferior vena cava. Deoxygenated blood came from superior vena cava and inferior vena cava into right atrium. Then from the right atrium blood goes into the right ventricle with the help of tricuspid valve. Here is present tricuspid valve. Next, from the right ventricle blood go enter into pulmonary arteries with the help of pulmonary valve. From the pulmonary artery blood goes into the lungs, and from the lungs blood go toward left atrium with the help of pulmonary veins. There are four pulmonary veins. Next, from the pulmonary veins blood enter into the left atrium, and from the left atrium blood enter into left ventricle with the help of mitral valve, also known as bicuspid valve. Then from the left ventricle blood goes into the enter into the aorta with the help of aortic valve. This is about chambers of the heart and walls of the heart. Anterior posterior relationship of structure inside chest including heart and great vessels. Here is a cross section of the chest, MRI, cardiac MRI. Here is MRI, and in MRI this is a surrounding black areas, and these black areas are lungs. Okay, and next here is a right ventricle. In right ventricle anteriorly of the in front of the chest. Behind the right ventricle lies left ventricle. Here is a left ventricle, and these white areas show to the blood. Next, left ventricle behind the right ventricle, and here is a left. This white area is a left atrium, and in left atrium behind the left atrium is a esophagus. Just behind the left atrium lies esophagus, and behind the esophagus lies this white area is a aorta. Its main between left atrium and aorta lies esophagus. If due to any problem, if someone suffering from the mitral, here is a mitral valve, okay, between left ventricle and left atrium. If someone suffering from the severe mitral stenosis, it's mean nerving of the mitral valve, then bloods accumulate in the left atrium, and the pressure in the left atrium will be increased, and increased pressure can compress to the esophagus and can lead to the difficulty in swallowing. And after that, his and also right ventricle in front of the chest, and often injured in penetrating traumas, more commonly or injured right ventricle due to in anterior of the chest, and also left ventricle having thickest wall, and right ventricle having thinner walls. So let's talk about coronary arteries. Here is the aorta, and from the aorta arises two arteries, left main artery and left main artery. Next bifurcate into two arteries. One is left circumflex artery, and second is left anterior descending artery. Left anterior descending artery supply blood anterior wall of the left ventricle, and left circumflex artery supply blood to the lateral wall of the left ventricle. Next, here is right coronary artery and supply blood to the right ventricle. After that, PDA. Here is not shown PDA, posterior descending artery, but posterior descending artery is a branch of right coronary artery in the 90% of peoples, therefore it's called 90% right dominant and 10% left dominant. And if in 10% people's uh, posterior descending artery is a branch of left circumflex artery and is called left dominant. It's mean 90% right dominant and 10% left dominant. So venous drainage of the heart into coronary sinus and coronary sinus drain into right atrium. Next, let's talk about coronary artery territories, and this slide is very important regarding MI. When we discuss about myocardial infarction, then also again repeat this slide. Anterior wall, anterior septum are apex of the left ventricle supplied by which artery? Left anterior descending artery. This is a MCQ point. Next, lateral wall. If we discuss about lateral wall MI, then we should know which artery is supplied to lateral wall of left ventricle. Lateral wall of left ventricle is supplied by left circumflex artery. And next is inferior wall, inferior septum between left and right ventricle is supplied by PDA. What is meant by PDA? Already discussed, posterior descending artery. And in 90% people, posterior descending artery is a branch of RCA, right coronary artery, and in 10% PDA is a branch of left circumflex artery. 90% RCA and in 10% left dominant mean left circumflex artery supplied to PDA. Next, let's talk about occurrence rate. Occlusion occurs most common in left anterior descending coronary artery. Next will be and least likely involve left circumflex artery and in the middle RCA. And this is important for MI. Let's discuss about mitral wall. Mitral wall having leaflets, having two leaflets, anterior leaflets and posterior leaflets. Anterior and posterior leaflets attached with two papillary muscles by caudate. Here is caudate. Here's I show by circle. Here is caudate. Two papillary muscles, anterior lateral, and two papillary muscles and posterior medial, also called anterior posterior papillary muscles. Anterior lateral, this is an important point regarding exam point of view. Anterior lateral papillary muscle has dual blood supply. This is very important by left anterior descending coronary artery and left circumflex coronary artery. But on the other hand, posterior medial papillary muscles has single blood supply. Should be remembered. Single blood supply, and usually right coronary artery and or left circumflex artery. Next, let's discuss about inferior wall infarction. Inferior wall infarction can lead to rupture of posterior medial papillary muscle. Why? Because already discussed posterior medial papillary muscle supplied by single blood supply, usually by right coronary artery or sometimes left circumflex artery. Therefore, due to single blood supply, most vulnerable to infarction, and this is also important regarding example 2. And in infections, inferior wall infection can lead to rupture of the posterior medial papillary muscles and resultant will lead to the severe mitral regurgitation and acute heart failure. Next, anatomy of the cardiac electrical system, and here is the components of the electrical system, cardiac electrical system. First of all is SA node, then AB node, then bundle of his, and after that right bundle branches and left bundle branches, and last but not least Purkinje fibers. First of all, MCQs. SA and AB node usually supplied by right coronary artery. SA node is found lateral wall of the right atrium, and SA node is a pacemaker and having automaticity. SA node don't need to any kind of impulse. SA node generate impulse by cells, therefore called automaticity. SA node, when generate the impulse, they travel toward the AB node by internodal pathway, then from the AB node to bundle of His, and then from the bundle of His, impulse travel toward right bundle of branches, and then the left bundle of branches, and after that then the Purkinje fibers. SA node located on the right atrial wall, AB node located interarterial septum, and bundle of His located interventricular septum. So this is all about anatomy of the heart. Thanks for your attention, for your listening. See you in next video.